Okay, hello everybody. This is Brother Wolf. This is HS 375, and the presentation today is on long-term care facilities. I will turn it over to that group. Whenever you're ready, feel free to start.
Okay, hello everybody. Welcome to our group presentation of managing long-term care facilities. Our PowerPoint is on long-term care and the key factors in the industry. And each of us is going to be summarizing the information because there is a lot to go over with this topic. And we know that you will be reading the slides later on your own. And next slide, please. So the first aspect that we wanted to go over is long-term care. This explains that long-term care focuses on the activities of daily living. And you can see kind of what those are. It is segmented into different levels of services and facilities for chronic conditions of both the elderly and the disabled. And now we will go to the history. Next slide, please. So long-term care began in nursing homes. It was introduced to help lower the cost for seniors who were not able to afford health care. This helped implement a lot of quality care to these citizens. And in 1935, SSA was enacted, and that is the Social Security Act. And this was able to allow individuals with needs to access government funds to help pay for their care. And it was primarily used for nursing homes. And in 1965, a couple amendments were made to the Social Security Act, which was the Medicare and Medicaid programs. Medicare was primarily focused only on acute care, whereas Medicaid required that all long-term care was to happen within an approved institution. And if the institution was not able to uphold those standards, they were able to remove funding away from that institution. Next slide, please. And some other key events that happen in long-term care, this is primarily the world that we live in. In 2010, the Affordable Care Act was introduced, and this gave millions of people access to health care who otherwise could not afford it. The government emphasizes and gives a lot of incentives for community or home-based care, and long-term care is supposed to be less expensive and for a broader range of baby boomers reaching retirement. And now we're going to turn the time over to Andrew, and he's going to go over some things that he has prepared with the Great Society and the Older Americans Act. Next slide, please.
Garrett, Andrew's not here, I don't think.
Okay, gotcha. Okay, so the Older Americans Act, it's authorized a wide array of service programs throughout a national network of 56 state agencies, 629 area agencies on aging, and nearly 20,000 service providers, 244 tribal organizations, and 2 Native Hawaiian organizations representing roughly 400 tribes. So the funds from this go to the Title III grants for states and communities aging programs, and they provide supportive and nutrition services, family caregiver support, disease prevention, and health promotion. And the Government Accountability Office report in 2011, you can see a little bit there, and the GAO also found that many people aged 60 and older who had difficulties with daily activities received limited or no home-based care. And the funding for the Older Americans Act is supplied way behind with the amount that is being demanded. And next slide, we're going to go over to Lucy.
Oh, actually, those were skipped. Sorry. The Great Society with Lyndon B. Johnson. The slide before, sorry. That was the Great Society was a huge push for social legislation, and in 1960, 20% of the U.S. population, or 40 million Americans, were classified as poor. This program was aimed at raising the quality of American life by eliminating poverty and inequality. Some people say President Johnson rushed some of the legislations and just pushed them right through too quickly, but in 1969 the number of poor had fallen to 12%, or roughly 24 million Americans. And Garrett had next slide please, and next slide please, because Garrett had already explained that. All right. The next 3 slides concern CMS benefits, which are under the Federal Department of Health and Human Services. Medicare is funded through FICA withholdings as well as income taxes from Social Security benefits, interest on hospital insurance trust funds, investments, and some Medicare Part A premiums. As a side note, studies indicate we end up receiving about 3 times what we actually put into Medicare. The main point on this slide is that Medicare is meant to cover conditions that are expected to improve. So if someone has a health event, Medicare will cover limited days on the premise that your condition is temporary. If it is determined that you are not improving, you fall into the category of long-term care, which is not covered by Medicare. Next slide, please. Medicaid does cover long-term care if you qualify. It is jointly funded by the state and federal government. Each state decides the requirements for eligibility and runs the program for their state. To the left are the main federal officers involved with CMS policy and benefits. Next slide, please. Benefits are based on activities of daily living which are related to self-care issues. An individual usually has to have help with at least 2 ADLs to be eligible for coverage. Next slide, please.
The goal of home health is to treat an illness or injury in your home. Home health usually comes from a service or agency that dispatches skilled nursing or assistance and a wide range of healthcare services. It is usually less expensive, more convenient, and just as effective as care you can get in a hospital or skilled nursing facility. Home health isn't just skilled nursing care, it's also non-skilled assistance with some ADLs and other tasks. Medicare and Medicaid doesn't cover non-skilled assistance. An assisted living residence or assisted living facility is housing for people with disabilities. These facilities provide supervision or assistance with activities of daily living and coordination of services by outside healthcare providers. They also provide activities to help ensure their health, safety, and well-being. Independent living is another level of assisted living where residents can contract for services made to make their lives easier, then obtain other services when needed. Special units or memory care units are for residents that require extra monitoring because of dementia and are usually locked down. This is usually paid with a single monthly payment.
Treatment and rehabilitation centers falls into 3 main categories: physical therapy, occupational therapy, and speech language pathology. Patients here need more personal attention because they're going through either a physical or a mental injury. The main managerial challenge here is next slide, please.
Nursing homes and skilled facilities. What distinguishes nursing homes from assisted living facilities is the level of medical care that is provided. In assisted living facilities, all medical care is delivered by outside healthcare providers, while in nursing homes, skilled nursing care is provided in the facility. Based on the medical needs of its residents and the type of facility, nursing care levels can vary, just like the levels of assistance with the ADLs can vary. Normal ranges are anywhere between 8 to 24 hours of licensed nursing care per day. The term nursing home is a technical term that refers to many types of nursing facilities that lie within this nursing home umbrella. They provide differing levels of assistance with the custodial care, or ADLs, as well as varying levels of nursing care. And they're primarily broken down into one of 3 categories. Intermediate care facilities are primarily for people with developmental disabilities. They provide limited or intermittent medical care, usually 8 hours of licensed vocational nursing or psych tech care per day. The funding source for ICFs is almost exclusively Medicaid. Next, nursing homes serve primarily the elderly and disabled and can provide up to 24 hours of nursing care per day. Now, this medical care is less intensive than found in a skilled nursing facility. Licensed by the state but not Medicaid certified, nursing home providers rely upon private pay and long-term care insurance for their funding. Skilled nursing facilities, the fourth and highest level of residential care, are special types of nursing homes. They provide more intensive medical care than regular nursing homes, serving primarily the elderly and disabled, but also the developmentally disabled. A skilled nursing facility is a special type of nursing home that has been Medicaid and Medicare certified. Therefore, a SNF, or skilled nursing facility, may receive funding for long-term care from Medicaid. Next slide, please. The long-term care system is a large, complex configuration of services developed over a relatively short period of time. Workforce shortages, unstable financing, and governmental licensing, regulations, and oversight are among the central challenges facing the field of long-term care. Next slide, please.
Hospice focuses on end-of-life care. The most frequent place for hospice care is at home. Hospice will explain what will happen as your loved one continues to decline in health. Managers have to deal with cultural barriers and the way different cultures deal with death. A lot of the challenge with hospice care is just trying to keep things positive because of the fact that it is end-of-life care. Next slide, please.
There are many professional advocacy organizations and associations for long-term care providers and also for aging Americans who are receiving long-term care. Long-term care advocacy organizations advocate for quality care and services for elderly Americans and lobby for legislation that protects the rights and benefits of seniors long-term care. Next slide. There are also many professional organizations that provide licensing, credentialing, and certification for administrators of long-term care facilities. Belonging to a professional membership organization can provide opportunities for professional growth and help to maximize your success as an administrator. Next slide.
If somebody's speaking, you'll have to unmute your microphone. I wasn't hearing anybody.
Sorry, I thought I did. So Wesley Homes, Lee Hill, is an assisted and independent living community where I live. It is becoming a one-stop shop for senior and long-term care, and I've included a short bio on the slide. Scott Hewlett is the executive director, and I've worked with him on several occasions on other projects. I asked him for an opportunity to pick his brain about his facility and the challenges of long-term care. The highlights from the interview are mentioned on the slide, but the biggest one for me was we are caring for very vulnerable people 24/7. We spoke about what skills were most important to manage a long-term care facility, business and finance skills to manage the day-to-day operations, personnel management to manage staff challenges, and industry skills in the regulatory environment because of the constant changes in the healthcare landscape. General management concerns for Wesley Homes Lee Hill are very close to the other ones that were found on the other slides. I also asked about what he found were the biggest challenges for his facility. Because this facility is a not-for-profit, they have some concerns that would be different than a for-profit facility. We think that this information from an operating facility would be useful for our classmates.
The next two slides are our references. Next slide, please. All of the website links should be clickable. Next slide, please. We hope you'll find our presentation useful and informative. Thank you.
Excellent. Very well done. So just a couple of things. If you would, you may have already done this, post the slides in the discussion board. That would be great. And then if you'll monitor the discussion board just to make sure see if classmates have questions or comments. If you would engage them there, that would be helpful. The other thing I wanted to mention was just kind of a reminder of some of the material that I believe it was last week. You guys covered the Older Americans Act very well. You covered the ADLs, Activities of Daily Living. I think you did a great job on the different types of long-term care facilities. And if I could just kind of summarize kind of the hierarchy, you know, as people get sicker, they kind of go up in level of the kind of care. And so if you were to go in ascending order, the first one is just the assisted living, which, as you mentioned, it's essentially it's almost an apartment complex, and there's some assisted living, but the individuals are living more or less on their own. After assisted living, you get into the nursing homes, and there's different acuities within nursing homes. And one type of nursing home is the skilled nursing facility. And then if people, sometimes beyond that, you have people that get home care would be the third level, and last is the hospice, as you mentioned, the end of life. So that's kind of another way of thinking about it. Also, on the payments, you talked about how Medicaid, and you are accurate and correct, Medicaid is by far the largest percentage of payment for long-term care. Don't get that mixed up with Medicare. Medicare is second. Normally in healthcare, we think that Medicare is the major player, and that's true in other kinds of settings, such as a hospital, for example. But in long-term care, Medicaid is the largest, and Medicare is the second. I think the numbers in some of the charts were, I think, around 40% of all long-term care is paid by Medicaid, and about 23% is paid by Medicare. So just kind of remember those are the big buckets of payers. And then after that, you get people paying themselves, or they have a supplemental or private insurance as well. So excellent job. Do you guys have any questions or last-minute comments?
I just wanted to let you know that Andrew was not able to come on, but he did work hard to do his slides, and so he's really sorry that he wasn't able to connect for some reason.
Yeah, no problem. And as individuals, you can send me, if you want, an email if you feel it's necessary to tell me how you felt the workload was handled. If everyone handled it equally, you don't have to send me anything. I'll just assume that everyone shared the workload equally, unless you tell me otherwise. And just do that in a personal, private email if you feel the need to do that. Excellent.
The other thing was just if anybody wants to check out that 20 problems with nursing homes that I posted on the last.
Yeah.
That was really informative.
Yeah, thank you for doing that. So Christine's referring to a post in the discussion board. Was it last week? I think you posted
it was on last week's chat board.
Right, and it was a good reference to some of these principles. Long-term care is a real growing area in healthcare. Just think about the demographics of the country. You know, most people are getting older. That section of the population is going to become a bigger section of the population, and they're going to need long-term care. So in these different levels of long-term care as well. So this is a really important area to be learning about, and explore it as a possible career option. So thanks for sharing that with me. Okay, well, I'll let you go. Thanks for the great work, and I'll post the link to the recording once it's done processing.
Okay. Lucy, are you going to post this?